If you are covered by an employer-sponsored health care plan, family premiums have now risen by a whopping 47% over the course of the last 10 years, which depressingly has outpaced wage growth, which has grown about 31%. And then in that span, general levels of inflation overall up about roughly 23%.
A report from the Commonwealth Fund found that in 37 states, workers' health insurance premiums and deductibles eat up at least 10% of a worker's median income.
The U.S. spends about twice as much on healthcare than other large and wealthy countries do.
The U.S. healthcare system is not as effective when it comes to controlling costs compared to systems in other countries.
Since the start of the pandemic in late 2019, early 2020, it felt like the world stopped moving. But the truth is, it never really did. The United States as a country has changed over the course of these last 2 years. There were thousands of people hospitalized and many were dying every minute. Millions were unemployed, there were nationwide protests, a tense election, vaccines were created, an insurrection happened, and the United States had a historical event right after the other. This pandemic was a wake-up call for many people. What it showed was how the systems that were set in place to help the average person does not work, and has never worked. This pandemic highlighted these problems in these systems, starting with the healthcare system, and more specifically, the health insurance system. This is health insurance in the United States. Health insurance is a plan or policy that pays for a portion of one's medical visits and hospital expenditures. It protects one from paying the full cost of medical events, whether planned or unplanned. When deciding on health insurance, there are several types: employer-sponsored, individual, family plan, Medicare, short-term, dental, vision, and many more. There are also several ways to pay for health insurance. Premiums are the monthly payments you make to your insurer. A deductible is the amount you must pay before the insurance company begins to pay its portion of the claim. Co-payments are the amount you pay once your insurance company begins paying.
My name is Michelle Rodriguez. I am 31 years old. I work for the hospital. I do the billing department. I do the back end. So I work the claims that drop in the clearinghouse. I make sure that the claim goes clean to the insurance. So whatever procedure the patient has done, whether it's lab, oncology, whatever the patient went in, whether it's inpatient or outpatient, I make sure that that claim has all the information that it needs to go to the insurance and, try to make sure that doesn't have any type of denial.
Health Maintenance Organization, or HMOs, and Preferred Provider Organization, or PPO, are the most popular types of health insurance. An HMO is a plan that offers members care within a specific network of doctors, hospitals, and other medical providers, meaning you have to go to specific facilities that the insurance company chooses in order for the company to cover the cost. In comparison, PPOs are more flexible, allowing members to go to any medical provider in or out of network. However, the cost is more expensive.
A good example is my insurance. I can only go to in-network services in order for me to get covered. If I go out of network, I will have to pay a deductible or co-insurance. When people apply, sometimes they're covered for certain things and sometimes they're not. They actually have to pay out of pocket. So when you're applying to insurance, you need to make sure that, one, your doctors are under contract with them. Because if they're not, you're not going to get covered.
Medicare and Medicaid are similar in which they are government-run programs. However, Medicare is a federal program given to those who are 65 years old and above, or those below the age with a disability. Medicaid is both a federal and state program given to those with a very low income.
A lot of doctors recently are not in network is because insurances are doing an audit with their clients. And if the doctor have a high cost, which means that they send the patient, they do too much tests, which is costing them too much money. There's a patient that goes out for every 3 months, he has to do blood work, or every 2 weeks, or anything, or they're always getting admitted, which is our elderly patients.
Just like other systems, there are some problems in the health insurance system. starting with the elderly. Those above 65 are at a higher risk of poverty due to the high cost of health insurance. According to a survey made from the Commonwealth Fund, older Americans pay more for health care and are more likely to not get care for cost-related reasons than people in other high-income countries. This means that in the United States, at least 7% of elderly people avoid doctor visits and skip medical treatment and tests because the costs are so high. However, there are programs in place that help patients that do not have insurance with the costs.
We have something called Compassionate for Charity Care, which is run by the state. Your income, things like that, they run your background check. And if you qualify, you get certain percentage coverage. And it lasts for a year. So let's say I have no insurance and my yearly income is $45,000. Let's say I qualify. They decide how much they're covering. So let's say they say, okay, you have 80% charity care. 80% of your bill is going to get covered, and the rest the other 20% you have to cover it. There's certain patients that do get 100% coverage, so that bill gets written off.
Charity Care, or the New Jersey Hospital Care Payment Assistance Program, is a free program that people can apply to when they're in the hospital and do not have health insurance. If they qualify, all their hospital bills or part of it can be covered. However, there is still a problem with many people in America being uninsured. According to the Department for Professional Employees, when the Affordable Care Act was put in place, it allowed people to apply for government-run programs such as Medicaid and Medicare. However, in 2014, 10.4% of Americans were still uninsured, and those who did have insurance had to pay high deductibles and premiums. Similarly, about 20 states have yet to expand on their Medicaid eligibility. Also, the Affordable Care Act has yet to give undocumented immigrants the chance to apply for health insurance, since many do not have a Social Security.
Do you think it's a good thing or a bad thing that the government is putting in limits of what they can do?
Well, I think they should do a reform towards insurances. Instead of them revising insurances, now they're going to try to do a cutback on nurses' pays, salaries, which I think that's redundant to the point that, are you kidding me? We're going to end up with no nurses. Nurses were dropping like flies during COVID, and now you're going to do like a cut on their salary. You know, that's very scary. The fact that they would do it to a health care worker who needs to pay because they're the ones paying the price, taking care of these sick patients, instead of health insurance, which is ridiculously expensive.
Everyone in the United States, regardless of their race, gender, age, and immigration status, have the right to receive proper health insurance, and the United States has the job to provide its people with this right. People should be more educated about health insurance, that way they can have a proper footing in controlling their health.
Like, when do you think people should start educating themselves?
When you graduate high school, when you become an adult, at the age of 18, you should have your own IRA. You should have your own insurance, doing your own taxes. You know, it's just start moving. Basically, what your parents are doing, you should be doing. Independence, completely.